I'm excited today to help announce the launch of a unique initiative called Accelerate Health Equity. This collaborative partnership targets health inequities using real-world solutions to change health outcomes and change the future of health and well-being for all Philadelphians.
Philadelphia is always 67th out of 67 counties for health in Pennsylvania. We are the poorest big city in America. Poverty is the metric that is most closely associated with poor health, that and joblessness, which we also rank very high on. And what do we do different so that that changes? And that's the essential question.
To put health equity together, to me, that means that any individual, regardless of where they live, what color their skin is, who they love, what they believe in, how they identify, they're able to attain complete physical, mental, and social well-being.
What we need to do now is convert talk to action. I think it's important as we launch this initiative to remember how we got where we are today. America was facing a common enemy in COVID-19. And in May of 2020, with George Floyd's murder, we had an opportunity to again come together as a community and address structural racism and health inequity like we've never done before.
When you look at healthcare and how it's changed over time, I think hospitals and a lot of healthcare institutions have traditionally functioned where we serve those people that walk through our doors, but haven't necessarily done a really good job of getting outside the walls of the hospital and getting what we often refer to as more upstream.
If we don't put the we before the me, then we're not going to be able to fully address these issues that we're challenged to address, that we're called to address, that we must address.
I think a number of us have been informally collaborating over a number of years, and we can't escape the fact that in the past 2 years, Black and brown communities have lost more than 3 years of life expectancy. That is astounding.
I think the challenges locally mirror the national issues, but at higher rates. We have the same challenges as everybody else, only perhaps on a steeper mountain to climb just because it's so pervasive.
I feel a responsibility to be part of the solution. We've got great partners in this region that, one, understand that equity is a problem, understand that there is disparity of care, understand that structural racism has contributed to a lack of trust in many of the communities we serve.
Institutions that were previously maybe seen as competitive really are saying health equity is important to all of us, and we owe it to our community to ensure that they have the best health outcomes possible.
We want to make the American dream and reach for everyone. It's something that we can't do on our own. It will take a lot of partners. And so something like Accelerate Health Equity is great because it gives us the ability to make sure that all of the different people in that healthcare ecosystem are working together, aligned with a vision.
What's been holding Philadelphia back in its fight for health equity is that all the institutions have been working towards this goal, but in their own individual silo. And Accelerate Health Equity gives us the opportunity to work together so that we can bring the best programs to scale across the city in a rapid time frame to really affect meaningful change.
When we rolled out the vaccine to our community, we went to the patients. We had a trusted voice in the community. That model of meeting people where they're at and where they're comfortable is sometimes a pop-up clinic, sometimes it's going to be a hospital, sometimes it's going to be an iPhone. But we have to meet the patient and the community in their environment.
This is one of the most talented regions in the country when it comes to health professionals, but there's been such a mismatch between need and demand and meeting that with the right kind of capacity.
I think this gives us an opportunity to leverage our strengths, share best practices, leverage relationships that we've all kind of established individually to address this issue. So I think that's where the real success is and what makes this a little different than what's traditionally been tried in the past.
Accelerate Health Equity has enabled us to meet so many fascinating people who are doing amazing work. And I think the opportunities include the ability to not reinvent the wheel in multiple areas. We are learning every day about exciting initiatives, partnerships, things that we can maybe do fairly well by ourselves, but we can do much better as a group and in collaboration.
There's no one-size-fits-all solution for any issue. We will hold ourselves accountable with the Accelerate Health Equity Dashboard. The dashboard tracks and shares every pilot program in the initiative and will be accessible to everyone.
Having that regional dashboard, using the data visualization tools to pinpoint where we should be intercepting disease is just going to be critical.
We all live and work in the same community and are treating the same families. We may be treating the children. Another hospital in Philadelphia may be treating the adults, but they live in the same house, in the same community, subject to the same stressors that are impacting their overall health.
Public health, despite its critical importance right now, is generally not very well funded. That isn't ideal. But since we know that a lot of health is really driven by poverty, is driven by lack of opportunity, I think there are real opportunities for us to partner and for other public institutions to partner with private institutions that have shared goals.
I think that the inequities that the pandemic just exacerbated really shed the light and made people realize how important it is for us to be here where we are doing the work that we're doing and helping people start to rebuild the community that we might have lost during the pandemic.
That public-private partnership is really critically important. If we have not learned from this pandemic that we have to really do something different, we never will.
It's our responsibility and duty to do all we can to build that trust back, to get people comfortable that they're going to get the same level of care, an equitable level of care that they deserve. That's the goal. I think we can achieve it.
I often think back to a conversation that my mom and I had growing up. And if you don't have your health, you don't have anything else.
The true meaning of we the people, it means everybody. Everybody gets to participate in what this country is all about. And I think that what better place than in Philadelphia for us to set the example for the rest of the country on how we're going to make that happen.
I view Accelerating Health Equity as not just a program, but a movement that will have a lasting legacy that will not only fundamentally change how we view one another, how we work together, and how we work to advance the health of the community.
Together,
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 we will
Accelerate Health Equity.